what are some of the emergency regulatory changes and updates that you're seeing that might most affect the direct physician practices?
So starting at the very beginning, whether it was regulatory or at the actual provider or facility level, there were a lot of changes that had significant impact on the way providers were conducting their business. That could range from the cessation of doing elective procedures in ambulatory care settings. It could also be within hospitals that they wanted to make sure they didn't have a full patient population in case there was a surge. A lot of screenings and other primary care type visits were either completely delayed or moving to telehealth. And with all of these changes in practice comes a greater risk of liability.
So, has the regulatory landscape adapted to the proliferation in telehealth services since the pandemic began?
You know, there have been some federal regulations that allow telehealth to be used more broadly and expand the scope of practice in terms of venue. But those have already been dialed back a bit, and it's really difficult to say whether that's going to have a long-term impact on sort of the breadth of how physicians practice.
And what are some of the new liabilities that physicians might be facing with these new telemedicine services?
I mean, with respect to liability in telehealth, the good news is that we have not seen any actual claims or incidents related to it yet. Of
Okay.
course, the risks are always there. There are cyber risks related to the security of those interactions. There's, of course, the issue with patients who may not have access to the proper equipment for telehealth. I've heard some upsides to the fact that you actually, from the provider perspective, they get a window into the patient's world and their environment that may give them some sense of why they have certain health struggles for, things that they deal with different conditions. But I think we're sort of waiting for the other shoe to drop. Again, this is a long tail business. And so it may be 6 months or a year from now where we find out that, the telemedicine dermatology visit where somebody, showed a lesion to the provider and it was determined that it wasn't necessary to biopsy that, that person should have been seen in person so that you could put hands on a patient. I mean, there is a reason that we typically do see our providers in person. But I think also, though, for some other telehealth specialties, that things will probably remain that way for quite some time, and that they're really benefiting from treating patients in the virtual world.